Hi, my name is Dr. Ashish Tareja. I am Senior Consultant in Orthopedics and Joint Replacement. So what are the symptoms of an ACL injury? ACL is a ligament which attaches two bones, that is femur with tibia. It is one of the strong ligaments of the knee joint. I would divide the symptoms into two parts. One is the acute symptoms when you get the injury, and one is chronic symptoms after the acute phase settles out. In the acute symptoms, the patient will have a lot of pain, a lot of swelling, so much so that he or she will not be able to continue the sport which he or she was playing when they got the injury. So this pain and swelling will get better with time. It might take a couple of weeks to get better with medications, with ice packs, and during this period we normally put the patient on a knee brace. Once this acute phase settles down, then comes the chronic phase, in which the pain will be less, the walking will be better, but the patient will have features of instability, which means that he or she will not be able to perform the sporting activity that they want. There will be instability while going up and down the stairs. There will be difficulty in running. There will be difficulty in doing certain twists and turns. So these symptoms are suggestive of instability. So if you have such symptoms, then it is better to go to your specialist doctor and get your injury evaluated, which will be done by an MRI, and according to the MRI assessment, the treatment plan will be laid.
सब्सक्राइब कीजिए प्रिस्टीन केयर चैनल को और बेल आइकन दबाकर इंडिया के एक्सपर्ट डॉक्टर्स से पाएं हेल्थ और सर्जरी से रिलेटेड सभी जानकारी।
Book your surgery appointment on pristinecare.com. Pristine Care.